Good afternoon, everybody. I'll just allow a little moment for participants for this webinar to join. So just give a moment for people to come and settle wherever you're joining us from around the country, or perhaps even around the world. You're most welcome. I'm delighted to be joined today for our March webinar in our monthly webinar series by Miss Arlene Bailey and Dr. Thomas Richardson to discuss a topic dear to us here at Aware, navigating bipolar disorder through psychological approaches. So this, as part of our monthly webinar series, I'm looking forward to the conversation together today with Miss Arlene Bailey, who's a lived experience expert, and Dr. Thomas Richardson, who's an associate professor of clinical psychology and cognitive behavioural therapy. And my name is Stephen McBride, and I'm the Director of Services at Aware. So we at Aware provide a monthly webinar series, and as part of that, in March, where World Bipolar Day takes place on the 30th of March, we try and have a webinar specific to bipolar disorder in March. Hence the conversation between Thomas, Arlene, and myself this afternoon. So I just, without further ado, would like to introduce you to both of our contributors and to thank you both very much for stepping forward and offering your time and your experience and your expertise on this area, which is very dear to us. And one of our core aspects of our work is supporting people who live with bipolar disorder. So if I started with you, Arlene, if you'd like to introduce yourself.
Yeah, no problem. Thanks, Stephen. So I am a professional singer. I was diagnosed with bipolar, I think now we're at about 5 years. So a late diagnosis. So I have many, many years of not knowing what was going on with my mental health. I had been treated for depression, and of course we know that there's more to bipolar than just depression. So obviously I wasn't on the correct path for quite a number of years, but I'm in a good place now because awareness is key, and I do certain things, whether it be medication based or therapeutic and the likes to keep my mental health in check and in a good place. So that's me.
Great, thanks, Arlene. And to you, Thomas, introduce yourself to the audience this afternoon. Thank you.
Hi, I'm Tom. So I'm a clinical psychologist, and I'm based at the University of Southampton on the south coast of the south coast of England. I did my undergraduate in Trinity College Dublin, though, so I've been aware of the work that Aware's done for quite a while now. So I'm here as a clinician and an academic researching bipolar, but I do have lived experience. I have bipolar disorder myself as well.
Very good, very good. Well, thanks for both of your introductions. And if I was to start with you, Thomas, perhaps if you could, give us an overview from your perspective of the psychological aspects of bipolar, as we think about, navigating bipolar disorder in this month of March when World Bipolar Day takes place.
Yeah. So I think a lot of people are told about, bipolar disorder as a medical condition, that there might be an element of genetics in there, that there's the brain. As a psychologist, I'm more interested in the psychological elements, which I think are quite clear and I'm biased, but very, very interesting. So people with bipolar can often be quite impulsive. As people will know, when they're manic, they can be particularly impulsive, but actually that impulsivity can be there even when people aren't well, even when people are well, sorry. Self-esteem, your confidence tends to be quite low, and people can be quite hard on themselves, but it varies a lot. When people are depressed, their self-esteem is rock bottom and their confidence, and then when they're manic, it might be overly inflated and feeling like you can do anything. Related to this, there's quite a lot of research about quite high standards, quite perfectionist, and maybe being quite self-critical, being quite hard on yourself when things do go wrong. We know that life events impact all of us. For bipolar, they just tend to impact people more. So the negative life events like bereavement or losing a job just seem to hit people a lot harder. They just feel it a lot more. But I think one of the uniquely challenging thing about living with bipolar is that it's not just negative life events, bad things happening, it's also positive life events can also be a trigger. So we did a survey with Bipolar UK and people reported stuff like getting a new job, getting a promotion, a new relationship can actually trigger mania. It's a slightly unhelpful stereotype about bipolar folk maybe being kind of tortured artists, geniuses, and there's quite a lot of people through history in the media and artists who did have bipolar, but there is quite a lot about creativity. People with bipolar are more likely to be in kind of creative professions. Arlene would fit in that as a professional singer. And when people are manic, they can feel very creative, very kind of inspired at times. And this relates to another thing that I think is really important about bipolar is, bipolar causes all sorts of problems and you don't get diagnosed unless it causes problems. But there are some people, not all, some people with bipolar might enjoy the early stages of mania or hypermania. When things are early, they might feel like they have more confidence, more creativity, more enthusiasm, and they might kind of go with that. One of the other things is that relate to this idea of high standards. Bipolar folk can have quite big ideas, quite big ambitions, for fame and for fortune and wanting to be very successful in their careers. They might picture in their head, have these mental images of what I'm going to achieve or the house I'm going to buy, that kind of thing. So kind of quite big ideas and really push themselves to maybe take on a little bit too much. And when you're manic in particular, there can be this real, like what I'd call a positive bias, where you're overly confident in your abilities and you're overly confident. So it really can just be that bipolar black and white, where when you're depressed, it's everything's going to go wrong and I can't do anything. And when you're manic, it can be the opposite. It can be very kind of strong beliefs that I can do anything, I can achieve anything, and you can be kind of overly confident. So that's a bit of a whistle-stop tour as some of the psychological.
Yeah, thank you for that overview, Thomas. In terms of, I suppose, what resonated most listening to you was thinking about the impulsivity, but also the self-esteem and that internal critic of being hard on oneself, and how that can manifest in different guises, I suppose, to do with an elated episode and also maybe a depressive episode or hypomania. So it's unique and maybe individual to each person, but those kind of psychological descriptors that you provided are very tangible and make a lot of sense, I dare say, to people listening in the audience this afternoon, and perhaps make sense to move to you, Arlene. Some of aspect of what Thomas has described may resonate and connect with you. So if you could.
I feel, Stephen, that Thomas was just describing me there.
Okay.
To be honest, I'm probably in the best job and the worst job as somebody with bipolar disorder. So as Thomas was saying, creativity then is heightened. It's brilliant. You're in a great place when you are kind of on that cusp of hypomania and the ideas are coming out of everywhere and nowhere. But the problem is that I am my worst critic. It's probably the worst industry. I'm trying to break into the acting side of things as well. So I'm constantly striving for greater things. I don't know where. I don't know what the highest point is for me, but I'm constantly chasing something, and with that then comes like the voices in your head, the negative thoughts, you beat yourself up. It's so again, it can be like the industry can be a good thing for me. It can also be detrimental to my mental health.
Yeah, no doubt. And I suppose, thank you for sharing that, Arlene, in terms of, your experience of it, and connecting in with what Thomas had shared. And I suppose if you were to tune into something, maybe, Arlene, for a minute, can you connect with the idea that around perfectionism and how, that might be part of what, you know, you experience, or that strive for getting things right all the time, and that there's never a bar that's steady enough, that you always have to reach the next thing or the next important thing, and that leading to maybe the feeling of not being good enough, maybe, you know, is that something that you can connect in with? Or
Yeah, definitely. I think my approach is failure is not an option. So, you know, if I set the bar that high, then it kind of, you know, you'd imagine the only way then is down. But yeah, it does come with it, and it's frustrating. And again, it's that arguing that happens in my head with myself. There's I put a lot of pressure on myself.
sure,
You know.
sure, okay, yeah. Yeah, that's not an easy experience, I dare say, and it comes at a cost, you know, this idea, you know, of perfectionism and putting pressure on oneself to get things right all the time. Because I suppose one of the adages that I try and link to maybe is that to be a human being is to make mistakes or to err, you know, and yeah, and that idea of perfectionism, Thomas, does that link in with some of your thinking, you know, in terms psychologically of what goes on for a person perhaps who's living with bipolar?
It does, yeah. That's something I'm researching quite a lot at the moment. We know that perfectionism's linked to, you know, depression and to anxiety problems as well, maybe linked to eating disorders, but it's definitely linked to bipolar disorder as well. The kind of high standards, quite perfectionist, and part of that is in bipolar is a real goal focused, which Arlene was kind of talking about there, wanting to, you know, the next thing. So setting very ambitious goals for yourself. That is something that is higher in bipolar, and people with these high standards tend to be a little bit more depressed and more anxious. So I'm just going to read a couple of questions from the kind of questionnaires I use to measure this, and maybe the audience can think, oh, does this apply to me? I have high expectations for myself. I rarely live up to my own high standards. If I don't set the highest standards for myself, I'm going to end up a second-rate person. And if you're hearing that on this webinar and going, oh, yeah, that feels a bit close to the bone, then maybe that's something that applies to you as well. So that does tend to be a trait in bipolar. You know, it's high standards, and like Arlene was saying, wanting more. And I think that the problem is if you have these very high standards, if you don't meet them, you can become really self-critical and end up in a depression spiral. If you do meet them, people don't just sit back and relax and go, you know, I can rest now. It's kind of on to the next thing, and what's next. So I think that's the thing you need to be aware of. If you have very high standards and goals, it's kind of it can be lose-lose sometimes. You're setting yourself up to fail, because if you meet your own very high standards, then you just kind of go, well, I need to push myself further. You know, it doesn't end, basically.
The bar keeps moving, as
exactly.
Yeah. Okay. And maybe people in the audience can connect or have connected with those, you know, statements that you've made, Thomas, around standards and them being reachable or not, and then the knock-on effect of that, or the impact of not meeting them, which can lead to a circular space maybe of self-criticism, or getting into that kind of place of giving out in your own head, in the internal self-talk that we all engage in, you know, and that can be a troubled space, I suppose, you know. Yeah. And if I was to stay with you for a minute further, Thomas, if we could get your thoughts in terms of the link between sleep and bipolar disorder, in terms of the impact of it, I suppose, and what your psychological understanding of that is, that'd be great.
Yeah. So, you know, we know from the diagnostic criteria for depression that sleep disturbance is often common. And for depression, this can go either way. It can be people sleeping too much, or people not sleeping enough. For mania, the difference is, I think, when depression, people might feel tired, but find it hard to sleep. You know, waking up early, worrying, or finding it hard to go to sleep at night because their mind's busy, their mind's full. For mania and hypomania, it tends to be more, high energy, less need for sleep, feeling like you don't need to sleep. So I think sleep is really important. It kind of occupies the space where it can be both like a trigger and an early warning sign, so people can get into this cycle. So again, the survey we did for Bipolar UK, 80% of people said that a lack of sleep had been a trigger for a relapse at some point. So it was by far the most commonly reported trigger for relapse. But then what happens is when people are starting to become unwell, their sleep gets even worse. So it can kind of become this cycle.
Yes.
And even outside of when people are mentally okay, when their mood's stable, there still can be problems with insomnia or problems with hypomania, hyper, sleeping too much.
Yes.
Can be a problem as well. So they are common in people with bipolar, and the limited research that's been done to date, one trial showed that just working on insomnia and sleep problems can reduce the risk of relapse. So that's
Very
something
interesting,
that I think we need more research on, but it is really important watching your sleep cycle to maintain stability.
Very good. Yeah, thank you for that, Thomas. Yeah, in terms of a proactive kind of aspect of it, to look after oneself for those in the audience who are living with bipolar, to consider the importance of sleep, and that maybe being a trigger or a warning sign, in terms of a mood disturbance, or a relapse, as you say, if sleep is disturbed, of course. And to move to you, Arlene, now for a minute, in terms of that, your sense of your connection or your resonance with that aspect of sleep, and if you could describe a little bit from the lived experience perspective, your experience around sleep and maybe managing stress as well too.
So I know if I'm feeling low, the tiredness, it's like a fatigue that you can't even describe. It's like it really takes over physically. And again, then when I'm in a kind of hypomanic state, I can run on empty. I don't need sleep. I do find as well, getting back to the nature of the job that I do, that I have to be very, very mindful that I look after the sleep side of things, that I know rest is vitally important, and structure, which is not always the easiest thing to manage in the music business, but to where to manage as best I can, to have a routine or catch up, and it's really important, but I think that the worst thing, and we all think that, as Thomas was saying, that at the start of that kind of manic phase, that this is a great thing and I have this energy and whatnot. In one way, I would nearly take that over the fatigue, as I said, the sheer exhaustion that comes with a low mood. It's really can be debilitating,
It may, yeah, absolutely. And it may be, I was tuning into what Thomas said earlier, and you're just after picking up on it, Arlene, that it's almost paradoxical, or it almost doesn't make sense, when people might be pointing out to you, whether it's hypomania or a full-blown elated phase, and you might necessarily be aware of the impact of that on yourself and others. But the initial aspects of it, or the initial few days perhaps of it, there's not a care in the world, or not a problem in the world, and it can be, in a strange way, as we're saying, maybe almost pleasurable or enjoyable, so that's what makes it there's a confusion maybe attached to it, or an uncertainty, and it makes it a very difficult mood condition to live with, of course, and we're fully cognizant of that, at aware, and it's very enriching for us all to have this conversation in terms of supporting and informing people who are living with bipolar, or who are out there who are in a relationship with someone with bipolar, of relationship of whatever makeup. Yeah, so thank you so far for that. And I am conscious that there's a few people asking questions and answers that I'll hope to get to in time. But if we just continue the conversation going for another little bit of time, I think that would be helpful. I'm wondering a little bit about the impact of I suppose we can all identify with this, is managing stress when we're fatigued or tired, and what it's been like, in terms of it. Are there any links for you, Arlene, in terms of thinking about managing stress in terms of your experience, lived experience of bipolar? What comes to mind when I ask that?
So I think it's really important to be able to say no to people. It's really important to be able to hit the pause button. And it's taken me 47 years now to realize that it's okay when things are getting on top of me to go, hang on for a moment. I just need to quite literally hit the pause button on life, in a sense, just back away from the responsibilities when you're feeling overwhelmed, because you continue to take on more stuff. I just think you're going to end up spiraling, basically. But that's what works for me. So if I'm feeling overwhelmed, stressed out, whether it be with work, whether it be with whatever's going on in my head, I would just say, you know what, take a breather, be kind to yourself. We forget to do that.
Yeah, and that's the antidote, isn't it, to some of what Thomas was saying earlier in terms of this inner critic or self-critic, and the link psychologically with that kind of position and bipolar, and trying to develop that kind of internal compassionate voice and self-compassion. It's very important, broadly in life, but also maybe more particularly for people who are living with bipolar. Yeah. And I think you've just mentioned something, Arlene, that's very helpful in terms of the pause button, or a boundary around saying no. So if I was to wonder with you about that, Thomas, in terms of that notion of the pause button, or kind of how to manage, I suppose, daily life activities and, activity levels within one's life. How does that make sense in terms of this webinar around a psychological approach to navigating bipolar?
Yeah, I think, because there is this impulsivity, especially for the kind of hypomania, mania side, and there can be a lot of sort of risk-taking often that can come with that. And I think, some of the big ones are impulsive spending, and also hypersexuality, and, with pressing the pause button, trying to delay is hard, but it is really important. So when I'm working with people, it'd always be, let's try and pause, let's try and press the pause button, hold this decision. You've got a big idea. It feels like it has to be done now. Can we wait until next week? Can we come back to it? Because, for me, it's okay to have big ideas and ambitions, but if it's that, but also I've got to do this right now, for me as a therapist, that's a big kind of red flag. So trying to put a little pause in, trying to put a little break in. And one of the informations that's going out after this, I believe, is a survey we're doing, because we're trying to build an app to stop impulsive spending, which is trying to do just that, where you try and press the pause button and what we call surf the urge, so the urge will kind of come and go.
Very good.
But changing your activity levels is really important. And I can see there's a question about any advice on getting out of the loads. What always amazes me is that, a lot of people with bipolar will think that, and they might have lived with it for a very long time, the only thing I can do to stay well is take medication. And medication is really important. And let me be very clear that all of the evidence about therapy, it's therapy on top of medication. It's not as an alternative. But actually, very relatively simple things can have a huge impact on your mood. So if you're starting to become manic, people will do things like, impulsive behaviors, more active, more socializing. So trying to just reduce that activity, stuff that's not quite as exciting, not quite as stimulating. I often use the term strategic boredom. That can really help bring your mood down. On the other side, if you're depressed, really trying to build in, schedule in activities, active, getting out, exercising, seeing people, hobbies, can really help lift your mood as well. And the important thing to say here is, one of my colleagues puts it best, because it's so hard to motivate yourself when depressed, but don't ask yourself, do I want to do this? Ask yourself, how do I feel after? So it is really often about trying to plan it in. I know it's going to be hard to get up, but I said to my friend, I'm going to meet them at the gym at this time. So I've got that in the diary, and that gives you a little bit of a motivation to get out and just trying to get back into some of that normal routine. Because what often happens with depression is people they don't do the usual things that give them enjoyment. They don't see the usual people. they
Sure.
hibernate, hide away, and that can fuel depression. So actually just being able to modulate your activity levels if your mood's going up and down can really help keep your mood stable.
Yeah, very good. Yeah, in terms of in terms of the depressed mood, working, to take the best next step. I suppose the same in relation to hypomania and maybe a full-blown manic episode, but obviously there's a continuum therein, and yet I suppose thinking too about almost the insight that's required around hypomania to use your word, Thomas, modulate or restrict or put some kind of barrier on engaging in what might be a reckless activity, etc., etc. And that can be tough. That can be tricky, no doubt, of course. Yeah. And in terms, I suppose, Arlene, your lived experience and thinking about it from that perspective, what's your sense of that idea of activity levels? And if you kind of tuned into it from maybe both aspects of bipolar, and what we've just been talking about, and does what Thomas had said from a psychological and from an emotional perspective kind of tune in with your experience in any way?
Absolutely, yeah. But I've noted down strategic boredom. That's not a concept that has ever crossed my mind. In a lot of cases, I feel like somebody needs to hit me with a tranquilizer going. But no, when I'm feeling low, I don't allow it to win. I'll always say to myself, this is going to pass. I know this will pass. But if in doubt, get up off your backside and go to the gym. You're not going to regret having got up and got out, So I don't allow it to take over, even though it's like it has a hold on me that I
Yes.
can't even verbalize. But I'll just say, do you know what? No, I have to get up. I have to move. I have to do the simple things. I have to get dressed. I have to have a shower. I have to do those things, and all those things are steps towards getting better. Because if I wallow, I think that's my greatest advice to people. Just don't let it take over you.
Yeah.
Yeah.
Yeah. Thanks, Arlene. And just to point out now, I suppose, to all of the audience, is that in terms of our offering, our service offering at Aware, we do have, an 8-week Living Well with Bipolar Disorder program, as well as a family support program, and we'll come to that piece about family support and, social connections and the importance therein. And the next offering of both of those programs are taking place. Those programs are starting the day after World Bipolar Day. World Bipolar Day is the 30th of March. And both of the next offerings of those programs are taking place from the 31st of March, Monday, the 31st of March. So if you're interested in learning more or receiving support in respect of bipolar, your lived experience of bipolar, please register for our bipolar disorder program, which is called Living Well with Bipolar Disorder, or our family support program. As I said, we'll come to that in a little minute. I'd like to move on a little bit, to think about mindfulness as being something that can be very constructive, supportive, and helpful in terms of the lived experience, or meditation, or that. Is that something that either of you would like to speak to, or make sense to either of you?
Well, I find it difficult to switch off. So meditation and me wouldn't really, it doesn't quite work for me, but I do find my own ways. Like, I do practice yoga. I believe in pet therapy. I have rescue dogs that just, they're
Yes.
my safe space. But yeah, I'm a big believer in talking things through as well. So therapy has worked wonders for me. But yeah, it's just a mixed bag of doing things. I think that it doesn't necessarily have to be something like meditation. It's whatever your version of that safe, happy space is, find that and just kind of, yeah, take the time for yourself.
Very good, yeah. And I suppose the idea of therapy, and you've mentioned it, and you've talked about your experience as a clinician, Thomas, and the idea of going to speak about what's on one's mind, and having that space to be able to bear witness to your story and to be heard and listened to and validated for those experiences inclusive, Arlene, as you scribbled down, maybe some tools and techniques around strategic boredom, you know, or surfing the urge, which was another comment you made, Thomas, which resonated, you know, in terms of supporting people who may be hypomanic, apropos, you know, risk-taking behaviours, etc., etc. So there's a plethora of support and help out there. Seeking to access it, I suppose, is the most important step. And if you were to speak, Thomas, maybe to mindfulness or you know, the aspect of that in respect of supporting that lived experience of bipolar.
So in terms of mindfulness and the evidence, you know, there's good evidence about mindfulness for kind of unipolar depression, people who get the depression without the manic side. There's really good evidence it helps reduce how often people kind of become unwell, relapse. For bipolar, the evidence isn't quite as strong that it reduces relapse, but it does reduce, you know, if people are feeling kind of acutely depressed or anxious, it does tend to reduce those acute symptoms. Whether it reduces the risk of people relapsing is another question. We know for therapies overall, therapies on top of medication, nearly half the risk of relapse.
Yes.
For mindfulness, it's not quite as strong, but I certainly use it personally. I use it with my clients. So, you know, being aware of the here and now, the present moment. Like Arlene said, if your mind's very busy, it can be difficult to do mindfulness. But I think using it to be aware of what's going on in your body, it's like, I think of it like a little check-in, like a little MOT of how am I doing today? What's going on? Is my mind busy, or am I having lots of self-critical thoughts? What's my energy levels like? So a little bit of a check-in, I find, to check how's my mood doing. Are there any early warning signs? I think mindfulness can really help with that.
Right. Thanks for sharing that, Thomas. And to move on to the idea, you know, Arlene, of family support or, you know, social connections, which are at the root of all of our lives, you know, who we connect with, you know. If you were to share a little bit, what has been helpful for you in your lived experience of bipolar in terms of relatives, friends, loved ones, about what they have done and maybe also what they have not done? Do you know what I mean? As in, you know, sometimes by saying little can be as important as saying too much, you know. So I suppose areas in your life that you have really felt supported by relatives and friends in terms of living with bipolar.
Well, I guess I'm very lucky that my husband is very clued in to what's going on. He'll see things before I'll see them happening. And actually, I did the Living Well program with yourselves, that 8-week program, which I found invaluable. He actually joined the group. There's an option to bring, as you know, a family member or spouse or whatever on to discuss, and that was kind of eye-opening as well, because I hadn't considered that he was going through this as well. I had just considered my feelings, my mood. So yeah, I think he found it helpful to take part in that. I found it to be, you know, a real eye opener that I guess you have to consider the people around you there too being affected by your mental health. But I suppose I'm still learning how to deal with people. To me, it's still early days, and I'm still trying to find ways to explain to people when I feel low.
Sure.
So I guess I just start with I don't feel well, you know, and hope that I find it, although I encourage everybody to talk about their mental health, you know, to speak out and seek the necessary help, I find it a struggle to tell people when I'm feeling unwell. So I'm trying to get better at that, you know. But I am acutely aware that I have a good support system around me. I have family that understand, and
Yes.
you know, that's vital as well. Once they have that level of understanding, they're there then to kind of navigate the whole thing with you. Yeah.
It can be very difficult for any of us to put words on our experience and to speak about what's going on in our mind. And that sense of fear or fright that is very apparent in terms of a mental health condition or a challenge around, whether in respect of bipolar, around a depressive episode or even an elated. And obviously an elated episode is more noticeable to family members or friends, but to be able to speak about it, and that's what we so often encourage and continually encourage people coming to aware, is to speak about what's going on in their minds, about their lived experiences of depression and bipolar. So I think your encouragement, Arlene, this afternoon, you know, to people out there in this audience who are living with bipolar to speak about it and to talk. And hopefully people in this audience have at least one person in their lives. You know, I know you've mentioned, Arlene, your husband, who's been great support, and I'm delighted to hear that for you, you know, that people have in their lives a person that is, you know, a support to them, because we're very conscious here and aware too that there's still quite a lot of stigma associated with the experience of, you know, not just depression, but maybe more pronounced with people who experience and live with bipolar, you know, and the sense perhaps of shame after an elated episode, or, you know, behaviors that went on therein. So we're acutely aware of that in terms of our understanding and thinking of people in the community who are living with bipolar. So thank you for sharing those pieces so far in the webinar, folks. You know, I just wanted to talk a bit about, and I suppose it chimes in a little bit about exercise, sleep and diet. And we've talked about activity levels, and that links to exercise, sleep we've mentioned. But in terms of diet, there's a question from a participant at the webinar wondering about the keto diet in terms of managing bipolar. Is there any sense of that, Thomas, in terms of the work that you have done? Is it the keto or keto diet?
I haven't done any work, but I am aware I think there's a couple of trials going on about a keto diet, which I think is like a high protein diet. I think there's some trials going on with some promising findings. That's all I kind of know about that. Yeah.
A couple of points in relation to a diagnosis of bipolar 2. Thomas, if you might want to speak a bit about that in terms of your understanding of what might be different therein, and how to manage that maybe, or navigate it, dare I say.
Yeah, I think, you know, the ways to live with it are very similar, whether it's bipolar 1 or bipolar 2. So bipolar 2 is hypomania. So hypo means it's not quite as severe as the full mania you'd see in bipolar 1. So bipolar 2 is hypomania, bipolar 1 is full mania. And then bipolar 2, you also have the episodes of depression, which tend to be a little bit more severe in bipolar 2. So bipolar 2, less severe hypomania, still causes problems, maybe more severe depression. Bipolar 1 is the kind of full, more severe mania where people might end up in hospital, and it causes all sorts of problems.
Yeah. Okay, thanks for that, Thomas. There's a person who sent a note to say that their episodes of bipolar are becoming more frequent, and they're requiring more stays in hospital and causing a lot of problems in their life. So I think that goes to speak to, you know, our understanding at Aware, and hopefully this conversation this afternoon illuminates and highlights, you know, that we're very conscious of the significant and debilitating impact that living with bipolar and episodes of depression, and also extreme elation or an elated episode have on people's lives, you know, and that lends to the impact too that it has on family members and loved ones, you know. So for those of you out there in the audience, or who may watch this webinar back, you know, and that you are in a relationship with, or that you're the parent of, or the sibling of, or the child of a person with bipolar, we have a family support program and a family support group for people to come forward and take part in. You know, on the family support group is on a weekly basis, and our family support program is running. The next 4-week program is going to be starting on the 31st of March. So for those of you who are interested in that, you know, please come forward and register. All our programs are free to every participant coming forward to enter them, you know. There's a question here which might be helpful, you know, and maybe if I direct it to you, Arlene, you know, what advice would you give to someone maybe working with an individual experiencing an elated or depressive episode, you know? And it is interesting to think about working or professional relationships, you know. So do you have any sense of that, you know? And obviously you're here on this webinar, and I know that you've been on other forums speaking about your story. So what's that like for you, navigating that in terms of your profession?
So meaning as in how I interact with
your colleagues or your band members or people that you know.
I don't know. I think again, the nature of the industry is a strange one. So when if I'm feeling low and I have to get on stage, like
Yeah,
the energy that's required there to pick yourself up and put yourself out there it's really it's a horrible feeling, you know. It's the last place that you want to be. I'm lucky. I think that those around me, I'm very open. I'm an open book, Stephen. I will discuss my mental health with people around me. So everyone is aware. So I think that maybe they see certain things. They do. They just, I don't know, they just leave me be.
I
I think that's
see.
important, you know. And again, I've a small group of people, you know, close friends and stuff in my world. So I think those that matter understand and just kind of give me the I suppose the leeway that I need. I don't know if I'm really kind of explaining it, because it's always difficult as the person with the disorder to think like somebody else, do you know? You tend to be a
Absolutely.
little bit more self-absorbed. So yeah, I don't know if I'm kind
No,
of
no, that makes sense. But I think, yeah, it's the idea being, I suppose, is how much you say or don't say, you know, or what leeway people give you, you know, or people maybe leave you alone, you know, all the while, you know, maybe thinking too that if you had something to say, that you'd say it, you know, about how you were, you know.
And I
So
guess if I am in a strange place, or if I am struggling, I do have a tendency to just like maybe point it out to people and say, look, this might explain that behavior to you, you know. But yeah, that's it. And again, as I said, those that are closest to me get it.
yes. Okay. Thanks, Arlene. Do you have a sense of that, Thomas, in terms of the workplace and how that's navigated in terms of living with bipolar, and, you know, how much to say and how much not to say? I suppose you've shared your own lived
Yeah,
experience there too,
yeah.
you know, and how that has worked for you, because I'm very conscious everyone will have different experiences of that, you know, and it can at times, and I've heard it in my experience here as aware, be very debilitating to reveal, you know, that you're living with bipolar in certain circumstances.
Yeah, so, and this is important, when we did a report with Bipolar UK just a few months ago about bipolar in the workplace and trying to build a kind of bipolar friendly workplace. It's always hard for me because I'm open with my boss, but you know, my boss is a clinical psychologist like me, so it's easier. But it wasn't always kind of like that. I think it's thinking about the pros and cons. I'm not sure, you know, in the UK, you do have some kind of legal protection about being discriminated against. I'm hoping there's similar legislation in Ireland so that you can be, but I know that people do worry about it. And I guess one thing I've always been wary of is people seeing you through the lens of, you know, you're bipolar when you're unwell, and lots of your behavior at work gets seen through that lens. So I think definitely thinking about the pros and cons. I would share, you know, as needed initially, not just like with everyone straight away. Tell your line manager if you need to. So thinking about, why am I sharing this and what will I get out of it? I think it is likely to be helpful. But one of the things I've done as well is just, you know, started a job, shown that I can do the job, and then have a conversation with my manager about my mental health. But the one thing I will say is that, you know, sometimes I've had conversations about, you know, telling my line manager about being bipolar when I'm acutely depressed. And in retrospect, it's like, I wish I'd had this conversation when I was okay, because actually I don't want to disclose all of this when I'm already a bit of a mess. So I think that's one thing to be aware of, is, do you want to have that difficult conversation with your boss when you're unwell, or do you want to do that when you're well? And I think if you can do that when you're doing okay, then that might be a little bit better.
Yes. Yeah, makes sense. In terms of there's a nice question after coming through in terms of the key aspects of a care plan, you know, and maybe you could take that from a psychologist perspective in terms of, then Arlene, maybe, you know, a care plan, you know, in terms of what you do. And I think you've touched on it already, to take good care in an ongoing way. It's linked a little bit to maybe what we were talking about in relation to the activity levels and stress and sleep. But if there's any further thoughts you might have on that in terms of a care plan, if you're living with bipolar 1?
Well, the sleep is huge, you know, to look after yourself, be kind to yourself, eat well, surround yourself with good people, do things that bring you joy in life, simple things, whether it be taking a walk on a sunny day, you know, all those things enable you to kind of wrap yourself in that bubble wrap that's required, you know, that you just, as I said, you need to look after your well-being, you need to look after your health, you know, physically and then mentally will kind of, they are obviously connected. So, I mean, if you're eating well and if you're well rested and you're not taking in too many, well, if you're not drinking too much wine, which is something I need to address, I'm a devil for my red wine, and you know that's not a good thing. You know, it's not. I wouldn't recommend it. Anything like that on top of a mental health problem or medication, it's not. So yeah, all those kind of things, they all mount up. You know, they again, as I said, it's what brings you joy. Take a look at what really makes you happy and spend more time doing things like that. That's just my experience or my opinion.
And as you said at the outset, awareness is key. And I think by engaging in different programs and therapy and speaking to loved ones and developing that self-awareness is very important, you know, because you have a deeper understanding of yourself then and how you navigate the world as we all do, you know. So obviously at Aware, you know, we're very supportive of that, of people speaking about that and trying to develop their own support structures and self-awareness. From your perspective, Thomas, is there anything you'd like to add in terms of that care plan idea for bipolar 1?
I think for bipolar 1 with the more severe mania, the mania is probably more likely to be the focus, and often what this is trying to do is really harm reduction, risk reducing, mitigation, so trying to damage limitation often. So it can be stuff like, you know, can I give my credit card to someone for a few days because I'm likely to impulsively spend, or do I need to go off work? What medication do I need to take? Do I need to think about being in hospital, for example, or change to my medication? So it really is, and that the care plan, I think it's really important to have this agreed, like with a health professional, if you can share it with people when you're well, and then you've got it there for when you're unwell.
That's very sage advice. Yeah, that's very sage advice. There's a comment and an observation in terms of missed experiences and the sense of grief or loss or what get carried, you know, and what your thoughts, Thomas and Arlene, are around, you know, the experience of missed or lost experiences and maybe how you've overcome them, you know, in terms of milestones in life to do with being unwell or whatever. So if you could share a bit about that, that might be helpful. How you've navigated through that psychologically.
I guess you can't beat yourself up. You can't really dwell on things, you know. If I try not to have any regrets about anything, good, bad, or indifferent, you know, because what's the point? Life's hard enough as it is, you know. So yeah, no, I don't know. I have a fairly positive outlook on life, and I tend not to. I can't do anything about those things. That's what I reckon, you know. And I'm fairly happy with where I am in life right now. So the good and the bad experiences got me here. I'll take it as it is, you know.
There's something about acceptance and self-acceptance in terms of what you're saying by the sounds of things, Arlene.
Yeah, I think so. Yeah. It is what it is, you know.
I think definitely acceptance. Oh, sorry.
No, go ahead.
I think definitely acceptance is important. Accepting that, you know, to live well with bipolar might mean there are some sacrifices. Like I said, the strategic boredom, and it's thinking about the pros and cons. There might be a fear of missing out. And I think if you are thinking about all the things I should have done, should, those shoulds, I should do this, I should do more, I should be doing this, probably links to all those very high standards you've got for yourself. Okay? So that's really important to remind yourself. It's don't, you know, you're probably holding yourself to a very high standard. Is it realistic, for example, for you to, you know, be back at work when you've been really depressed? Is it realistic for you to start straight back at work straight away, trying to be compassionate to yourself, not comparing yourself to other people who don't have bipolar disorder, because it's not a fair comparison. So yeah, living well with bipolar might mean that there are a few sacrifices that need to be made, but you shouldn't compare yourself to, you know, how I used to be 10 years ago, or how my brother's doing, because it's not a fair comparison.
And then the process of acceptance in terms of the diagnosis, and the desire to, you know, receive support in that regard, you know, and that maybe takes time too for people, you know. Obviously everyone's experience is unique, and it can be very helpful, you know, to receive a diagnosis, to get a sense of, Janie, now I realize what has been going on for so long. And then obviously accepting that, or working through that acceptance piece, with a view to, you know, developing on your strengths and moving on with your life and taking the best next step. And just a final question, and I'm conscious that, and thank you all as participants for asking the questions you have, you know, just a final question for you, Arlene, and linked to your passion and your profession, I dare say, you know, is, do you find that being in the moment of writing music or singing can silence that kind of, maybe some of the thoughts, that unhelpful thoughts in your head, even, you know, temporarily or in a more permanent way? What's your sense of that, you know, about tuning in to, you know, the positive aspect of creativity, isn't it, you know?
Yeah, it can be brilliant, because like my imagination can just run wild, and that's exactly what I get the opportunity to play when I'm on stage. You know, I can be somebody else. I'm not necessarily myself, but I can draw from the notions, the ideas, and as you said, creativity that comes with a mental health disorder. It can be useful at times. I know that sounds, you know, contradictory, but I never get bored. Like, there's always something going on here, whether it's good, bad, or indifferent. I don't, you know, so it kind of, it pushes me along. It definitely
Yeah,
does.
and invigorates you. Yeah,
Yeah.
great. Thank you for sharing that. I'm just conscious of our time, and we're heading towards the end of the time for the webinar. And I know there's been a few other points made in terms of questions about information on the programs that I have mentioned earlier on. So you'll get further information on the Living Well with Bipolar Disorder program, as well as the Family Support program, on our website, aware.ie/programs. You can also call our number, 016617211, or email info@aware.ie for further information. We are going to be engaging in some communication out in the public and promoting awareness and information about bipolar disorder to mark World Bipolar Day on the 30th of March. As I said at the outset of this webinar, you know, working with and supporting people who live with bipolar is a core objective of ours at Aware. So that's why it's very important for us to continue and keep having these conversations. And into that space, I'd like to sincerely thank our lived experience expert, Arlene Bailey, and also, you know, the professional expert, as well as, you know, your sharing of your lived experience, Dr. Thomas Richardson, our associate professor of clinical psychology, you know, and just to thank you so much for your openness and for giving of your time to share your experience, your thoughts, and you know, your sense of expertise from the work you've done on yourselves, and also with other people in your lives, you know. So thank you dearly from our perspective at Aware for your contributions. And just also to say to everyone, if you've been impacted by anything that has been said today, please reach out to our support line on 1800 80 48 48. You can go to our website and book a place on one of our support groups. Our website is aware.ie. There is support, education, and information out there for you, you know, for those people in the audience listening in who have been impacted by anything that was discussed in the openness of this webinar. So maybe just before we finish off, you know, I've said my last few pieces, but that if both of you would like to say in a few words, you know, what would be the most important thing you would like someone attending to take away from the webinar today? If we started with you, Thomas.
I think I'd say mania is scary. It feels like it comes out of nowhere and there's nothing you can do about it. But there will be early warning signs building up in the weeks before. And like I said, they're trying to reduce your activity, reduce the stimulation, can stop it escalating. So there is stuff you can do to stop it escalating.
Thank you, Thomas. And Arlene, last word to you.
Yeah, I would just like to say that ultimately the onus is on you. If you are suffering with your mental health, there's only so much anybody else can do for you. And just to know that there is help out there, as you're saying, Stephen, those courses that you offer are invaluable. Having lived or experienced it myself, having done the 8-week course, I was a bit reluctant. I didn't know that what I could take from other people who were suffering from bipolar disorder, if there was anything to be gained. And I would urge anybody that's looking for somewhere to start, look there, because, you know, it really helped me. It'll help you too.
Thank you, Arlene. And thank you both once again for your contributions, and to have a lovely day and week ahead, and to wish all our audience well in the afternoon ahead. And thank you all for your attention. Take care and go well.
Thank you, everyone. Thanks for having me.